my name is Crystal Lopez, and I'm a prevention specialist with SCAN's Futuros Brillantes YPU Val Verde program. Today, I will be providing a presentation regarding the topic of prescription drugs. There is a lot of misinformation and misuse of prescription drugs. I hope this presentation will give you the knowledge to help spread awareness about prescription drug abuse and also be able to help others. Drug overdose deaths continue to impact many communities across the United States. According to Centers for Disease Control, CDC, from 1999 to 2017, more than 702,000 people have died from a drug overdose. In 2017, more than 70,000 people died from drug overdoses, making it a leading cause of injury-related death in the United States. 68% of those deaths involved a prescription or illicit opioid. The misuse of and addiction to opioids is a serious national crisis that affects public health as well as social and economic welfare. The Centers for Disease Control and Prevention estimates that the total economic burden of prescription opioid misuse alone in the United States is $78.5 billion a year, including the cost of healthcare, lost productivity, addiction treatment, and criminal justice involvement. So how did this happen? In the late 1990s, pharmaceutical companies reassured the medical community that patients would not become addicted to prescription opioid pain relievers, and healthcare providers began to prescribe them at greater rates. This led to widespread misuse of these medications before it became clear that these medications could indeed be highly addictive. Opioid overdose rates began to increase, and the misuse and misinformation of prescription drugs has become a national issue in the United States. The objectives of this presentation is to know the proper use of prescription drugs, define prescription drug abuse, have knowledge of the most abused prescription drugs, know how prescription drugs affects the brain and body, know signs that may be prescription drug abuse, how prescription drug abuse is treated, and proper disposal of prescription drugs. So what are prescription drugs? Prescription drugs are prescribed by a doctor, regulated by the Food and Drug Administration, which is the FDA, and is only safe when taken exactly as directed by a doctor. So prescription drugs are usually bought at a pharmacy, and they're prescribed for and intended to be used by one person. It is regulated by the FDA through the New Drug Application (NDA) process. This is the formal step a drug sponsor takes to ask that the FDA consider approving a new drug for marketing in the United States. An NDA includes all animal and human data and analysis of the data, as well as information about how the drug behaves in the body and how it is manufactured. So what is the proper use of prescription drugs? Proper use means it is taken exactly as directed. This includes taking the medication at the right time, taking the right amount as directed, not sharing the medication with anyone, adhering to the expiration date, and disposing of the medication properly. Now, how do you properly dispose prescription drugs? The first thing you want to do is mix it with an unappealing substance. So this can be coffee beans, it can be cat litter, things like that. The next thing you want to do is place it in a sealed container and then throw it in the trash can. The next thing you also want to do is grab the prescription bottle and scratch out any personal information that is on there. And the reason it is important to properly dispose prescription drugs is to not make it usable or accessible for others to find and use. So it's very important to properly dispose of them to where others cannot continue abusing them or use it to sell. What is prescription drug abuse? According to the National Institute on Drug Abuse, prescription drug abuse is the use of a medication without a prescription in a way other than as prescribed or for the experience or feelings elicited. So when someone is abusing prescription drugs, they're usually using either someone else's prescription, they're taking more than what they're supposed to as directed by the doctor, or they're doing it to get some kind of high. This is when it becomes a problem for the person. Here are some facts about prescription drugs. These are 3 facts that are most commonly known. Uh, the first one is it is the most abused substance after alcohol and tobacco. So alcohol and tobacco are on the top of the list. Then comes prescription drug abuse. Prescription drugs recently has become a national crisis, and it is a huge issue in our country. The second fact is its most significant cause is lack of knowledge and understanding about the importance of proper use. A lot of the times people don't have the correct knowledge or the understanding of how to properly use these medications. It is very important to have that knowledge and also talk to your primary care doctor about it. Now, the third fact is one common belief is since doctors prescribe these medications, they must be safe. A lot of the times, because these prescription drugs are on the market and you can get them at a pharmacy, they're given out by doctors as a prescription, then they must be safe, nothing could happen. But in reality, that's not the truth. These drugs are addictive and you can get a lot of symptoms out of them that can be dangerous for your mind and body. Now, there are different types of abused prescription drugs. These are the 4 most common types that you will hear about or see. The first one are depressants. Now, these drugs slow brain function. They are used to make a person calm and drowsy and intended to reduce tension or anxiety. The next one we have opioids and morphine derivatives, generally referred to as painkillers. These drugs contain opium or opium-like substances and are used to relieve pain. The next one we have is stimulants. These are intended to increase energy and alertness, but also increase blood pressure, heart rate, and breathing. And last, we have antidepressants. So these are psychiatric drugs that are supposed to handle depression. Now, these 4 are the most commonly abused prescription drugs. The first type of prescription drugs are depressants. They are sometimes called downers. These come in multicolored tablets, capsules, or liquid form. They are known as major tranquilizers, antipsychotics, or benzos. These are some of the brand names they fall under. The most common one heard is Xanax, Valium, and these are some other ones listed on there. For street names, they are sometimes called downers, sleeping pills, tranks. There are different names for them. Now, depressants are used to treat anxiety, panic, acute stress reactions, and sleep disorders. Most depressants act on the brain by increasing the activity of the gamma aminobutyric acid, or GABA, a chemical that inhibits brain activity. This action causes the drowsy and calming effects that make the medicine effective for anxiety and sleeping disorders. People who start taking depressants usually feel sleepy and uncoordinated for the first few days until the body adjusts to these side effects. Other effects from the use and misuse can include slurred speech, poor concentration, confusion, headache, lightheadedness, dizziness, dry mouth, problems with movement and memory, lowered blood pressure, or slowed breathing. If a person takes depressants long term, he or she might need larger doses to achieve those therapeutic effects. Continued use can also lead to dependence and withdrawal when use is abruptly reduced or stopped. Suddenly stopping can also lead to harmful consequences like seizures, and these are depressants. Now, on the previous slide, I mentioned a few side effects of depressants. These are short-term effects, so the list is on the slide. This includes slow brain function, lowered blood pressure, confusion, dizziness, fever, visual disturbances, disorientation or lack of coordination, difficulty or inability to urinate, slowed pulse and breathing, poor concentration, fatigue, slurred speech, sluggishness, dilated pupils, depression, and addiction. Now, higher doses may cause impairment of memory, judgment, and coordination, irritability, paranoia, and suicidal thoughts. You may also experience agitation or aggression. If sedatives and tranquilizers are used with other substances, especially alcohol, it can cause slow breathing and heart rate and may even lead to death. So, can a person overdose on depressants? Yes, a person can overdose on depressants. An overdose occurs when the person uses enough of a drug to produce life threatening symptoms or death. So, when a person overdoses on a depressant, their breathing often slows or stops. This can decrease the amount of oxygen that reaches the brain, a condition called hypoxia. So, hypoxia can have short term or long term mental effects and effects on the nervous system, including coma and permanent brain damage. So, when someone overdoses, what can you do? The most important step, of course, is to always call 911 so the person who has overdosed can receive immediate medical attention from there. So, someone who has been using depressants for a long time can have long term effects, and this includes depression, chronic fatigue, breathing difficulty, sleep problems, anxiety, panic, risk of high blood sugar, diabetes, and weight gain. So, some of you may ask, can prescription depressants lead to an addiction or substance use disorder? And the answer is yes. So, the use or misuse of prescription depressants can lead to a problem use. A long-term use of prescription depressants, even as prescribed by a doctor, can cause some people to develop a tolerance, which means that they need higher or more frequent doses of the drug to get the desired effects. So, a substance abuse disorder develops when continued use of the drug leads to negative consequences such as health problems or failure to meet responsibilities at work, school, or home. But despite all that, the drug use continues. When someone has become addicted to prescription depressants and stops using the drug abruptly, they may experience withdrawal symptoms. So this can include insomnia, weakness, nausea, agitation, high body temperature, delirium, hallucinations, and convulsions. People addicted to depressants should not attempt to stop taking them on their own. Withdrawal symptoms from these drugs can be severe. In the case of certain medications, they can be potentially life-threatening. So it's very important for the person to see their primary care doctor, seek medical help if they did decide to get off of depressants. The next group of prescription drugs we're going to talk about are opioids and morphine derivatives. So these act on the nervous system to relieve pain. They come in tablets, capsules, or liquid form. So the most common prescription opioids of brand names you will hear is hydrocodone, oxycontin, or Percocet. There are some other brand names, and then in terms of street names, they may be called Captain Cody, Doors and Fours, Murder 8. There are a lot of names that they use for these, or even just painkillers. The most common slang terms that you might hear is Oxy, Perks, or Vikes. Opioids are a class of drugs naturally found in the opium poppy plant. Some prescription opioids are made from the plant directly, and others are made by scientists in labs using the same chemical structure. Opioids are often used as medicines because they contain chemicals that relax the body and can relieve pain. Opioids are mostly used to treat moderate to severe pain, and they can make people feel very relaxed or high, which is why some people decide to use it for non-medical reasons. This can be dangerous because opioids can be highly addictive, and overdoses and death are more common in the United States in regards to these types of prescription drugs. So these are listed is short-term effects and long-term effects of opioid and morphine derivatives. So how do these affect the brain? So the opioids bind to and activate opioid receptors on cells located in many areas of the brain, spinal cord, and other organs in the body, especially those involved in feelings of pain and pleasure. When opioids attach to these receptors, they block pain signals sent from the brain to the body and release large amounts of dopamine throughout the body. This release can strongly reinforce the act of taking the drug, making the user want to repeat the experience. So, some short term effects are drowsiness, slowed breathing, constipation, unconsciousness, nausea, or coma. And when a person is using them long term, the effects include restlessness, muscle and bone pain, insomnia, diarrhea, vomiting, cold flashes, or addiction. So, can a person overdose on prescription opioids? And the answer is yes, they can. So, what happens is when someone overdoses on opioid medication, their breathing often slows or stops. This can decrease the amount of oxygen that reaches the brain, which can result in coma, permanent brain damage, or even death. So, when you have someone who has overdosed, please call 911 and seek medical attention right away. Now, when a person is using prescription opioids for a very long time, it can lead to addiction. It can also lead to a substance use disorder, a medical illness which ranges from mild to severe and from temporary to chronic. So, when a person is addicted to them, it starts causing changes in the brain and it causes health problems, and they also fail to meet responsibilities at work, school, or home. People addicted to opioid medication who stop using the drug can have severe withdrawal symptoms that begin as early as a few hours after the drug was last taken. So these symptoms can include muscle and bone pain, sleep problems, diarrhea and vomiting, cold flashes with goosebumps, uncontrollable leg movements, and severe cravings. These symptoms can be extremely uncomfortable and are the reason many people find it so difficult to stop opioids. There are medicines being developed to help with the withdrawal process, but like I mentioned earlier, it's very important to talk to a doctor or seek medical attention. So the next group of prescription drugs we're going to talk about are stimulants. These are sometimes called uppers and temporarily increase alertness and energy. When they are abused, they are usually swallowed, injected in liquid form, crushed, or snorted. Prescription stimulants are medicines generally used to treat attention deficit hyperactivity disorder or ADHD and narcolepsy, which is uncontrollable episodes of deep sleep. So, stimulants usually increase alertness, attention, and energy. Some names are listed on here that you might have heard of. The most common one I've heard of is Concerta. There are street names for them. The most popular slang terms you might hear is speed, uppers, R-ball, bennies. There are different street names for them, but these are the most commonly heard. So the way prescription stimulants affect the brain and body is they increase the activity of the brain chemicals dopamine and norepinephrine. So dopamine is involved in the reinforcement of rewarding behaviors, and norepinephrine affects blood vessels, blood pressure, and heart rate, blood sugar, and breathing. Listed on here are short-term effects and long-term effects of stimulants. So short-term effects include increased blood pressure and heart rate, increased breathing, decreased blood flow, increased blood sugar, exhaustion, apathy, and depression. Some long-term effects include hostility, paranoia, high body temperatures, or irregular heartbeat. At high doses, prescription stimulants can lead to a dangerously high body temperature, an irregular heartbeat, heart failure, and seizures. So, can a person overdose on prescription stimulants? Yes. The answer is yes. A person can overdose on prescription stimulants. So, when a person overdoses on a prescription stimulant, they most commonly experience several different symptoms, including restlessness, tremors, overactive reflexes, rapid breathing, confusion, aggression, hallucinations, panic states, abnormally increased fever, muscle pains, and weakness. They may also have heart problems, including irregular heartbeat, leading to a heart attack, nerve problems that can lead to a seizure, abnormally high or low blood pressure, and circulation failure. Stomach issues may include nausea, vomiting, diarrhea, and abdominal cramps. In addition, an overdose can result in convulsions, coma, and fatal poisoning. The long-term use of stimulants can also lead to addiction or a substance abuse disorder. So when a person wants to stop the use of prescription stimulant, he or she can experience withdrawal symptoms, and these can include fatigue, depression, and sleep problems. The last group of prescription drugs we're going to talk about is antidepressants. These include Prozac, Paxil, Celexa, Zoloft, Effexor, and Remeron. These come in multicolored capsules and tablets. Studies have shown that the effects of these drugs can include insomnia, irritability, nervousness and anxiety, violent thoughts and actions, agitation, suicidal thoughts or suicide, tremors, hostility, sweating, irregular heartbeat, aggression, criminal behavior, confusion and incoherent thoughts, paranoia, hallucinations, psychosis, and akathisia. So, akathisia is a painful inner agitation, inability to sit still. So, antidepressants are medications that can help relieve symptoms of depression, social anxiety disorder, anxiety disorders, seasonal affective disorder, and dysthymia, or mild chronic depression, as well as other conditions. They aim to correct the chemical imbalances of the neurotransmitters in the brain that are believed to be responsible for changes in mood and behavior. These medications are used not only to treat depression, but for other conditions too. The primary or approved uses of antidepressants are used to treat agitation, OCD, depression, major depression disorder, generalized anxiety disorder, bipolar disorder, PTSD, or social anxiety disorder. Now, it is possible to overdose on any type of antidepressant, especially if it's taken with other drugs or medications. Overdosing on antidepressants can cause mild to severe symptoms. In some cases, death may be possible. So, when it comes to mild cases, mild symptoms can include dilated pupils, confusion, headache, drowsiness, dry mouth, fever, blurred vision, high blood pressure, nausea, and vomiting. When it comes to severe cases, which you may experience severe symptoms, this can include hallucinations, abnormally fast heartbeat, seizures, tremors, low blood pressure, coma, cardiac arrest, and respiratory depression. And some people may experience serotonin syndrome. So, when someone who overdoses on antidepressants may also experience this kind of syndrome. So, this is a serious negative drug reaction that occurs when too much serotonin builds up in your body. So, serotonin syndrome can cause nausea, vomiting, diarrhea, stomach cramps, confusion, anxiety, irregular heartbeat, changes in blood pressure, convulsions, coma, or even death. And now we're going to get into drugs in the brain. So when it comes to drug use, it's very important to understand the functions of the brain and how drugs can affect the brain. The brain is one of the largest and most complex organs in the human body. It is made up of more than 100 billion nerves that communicate in trillions of connections called synapses. The brain is made up of many specialized areas that work together. So it is made up of many parts with interconnected circuits that work together in order to coordinate and perform specific functions. Networks of neurons send signals back and forth to each other and to different parts of the brain, the spinal cord, and nerves in the rest of the body. So in these specialized areas that work together, the cortex is the outermost layer of brain cells. So thinking and voluntary movements begin in the cortex. The brainstem is between the spinal cord and the rest of the brain. Basic functions like breathing and sleeping are controlled in this area. The basal ganglia are a cluster of structures in the center of the brain. The basal ganglia coordinate messages between multiple areas in between. So the cerebellum is at the base and the back of the brain. The cerebellum is responsible for coordination and balance. So these are different parts of the brain that are responsible for different parts of the body and different functions. So the brain is also divided into several lobes. The frontal lobes are responsible for problem solving and judgment and motor function. The parietal lobes manage sensation, handwriting, and body position. The temporal lobes are involved with memory and hearing, and the occipital lobes contain the brain's visual processing system. It's very important to understand the functions of the brain. So here we have four different neurotransmitters that are responsible for different functions. The first one we have is dopamine. So dopamine regulates moods, enhances pleasure, involved with movement, reward and reinforcing behaviors, motivation, and attention. So dopamine plays a role in how we feel pleasure. It's a big part of our unique human ability to think and plan. It helps us strive focus and find things interesting. Next, we have serotonin. So serotonin is responsible for stabilizing moods and regulating emotions. Serotonin is a chemical that has a wide variety of functions in the human body. It is sometimes called the happy chemical because it contributes to the well-being and happiness. It appears to play a key role in maintaining mood balance. Low serotonin levels have been linked to depression. Next, we have the gamma aminobutyric acid, or GABA. This acts as a natural tranquilizer, mitigating the stress response, lowering anxiety levels, and slowing down functions of the central nervous system. So GABA is considered an inhibitory neurotransmitter because it blocks or inhibits certain brain signals and decreases activity in your nervous system. When GABA attaches to a protein in your brain known as a GABA receptor, it produces a calming effect. This can help with feelings of anxiety, stress, and fear. It can also help to prevent seizures. Next, we have norepinephrine. So this is called the stress hormone, as it speeds up the central nervous system in response to a fight or flight response. It is classified as an excitatory neurotransmitter, which means it stimulates activity in the brain, boosting the function of different cells to keep your brain and body running efficiently. It's important to keep in mind what drugs can do to the brain. So drugs interact with the brain and body to alter moods, emotions, and behaviors. It changes a person's perception and impacts how individuals interact with the world around them. With mind-altering drugs, it may slow down or speed up the central nervous system and autonomic functions necessary for living, such as blood pressure, respiration, heart rate, or body temperature. Brain chemical messengers and neurotransmitters are always impacted by drug abuse. Drugs are chemicals that work in the brain by tapping into the brain's communication system and interfering with the way nerve cells normally send, receive, and process information. There's always risky behavior associated with drug use, especially when it involves a youth. So this can cause impaired cognition or mental process, car accidents, high risk taking, unplanned pregnancy or parenthood, or getting into fights. The dangers of substance abuse are not just about the potential for fatal overdoses, they are also about what long-term drug use does to a person's personality and character. In fact, there's evidence that substance abuse can lead to a number of high-risk behaviors, which makes it a challenge for lawmakers, healthcare workers, and family members of addicts even more difficult. Many studies have shown that drugs interfere with the way the brain communicates, which means that drugs short-circuit how information is sent, received, and processed. We know that some of the effects of drug abuse on the brain involve the reward system by producing abnormal amounts of dopamine, a neurotransmitter that controls emotion, motivation, movement, and how we experience pleasure. But what makes it just as dangerous is that drugs can also have a negative effect on the parts of the brain that control decision making and impulse control. As a result, drug and alcohol abuse often lead to impaired judgment, which means that addicts are much more likely to take risky actions that they wouldn't have if their brains weren't compromised by drug or alcohol abuse. Why are drugs addictive? The brain of someone who misuses drugs adjusts by producing fewer neurotransmitters in the reward circuit or reducing the number of receptors that receive signals. As a result, the person's ability to experience pleasure from naturally rewarding activities are reduced. Now the person needs to keep taking drugs to experience pleasure and continues a vicious cycle. In reality, drug addiction is a complex disease, and quitting usually takes more than good intentions or a strong will. Drugs can change the brain in ways that make quitting hard, even those who do want to. Addiction is a chronic disease characterized by drug seeking and use that is compulsive or difficult to control despite all the harmful consequences. The initial decision to take drugs is voluntary for most people in the beginning, but repeated drug use can lead to brain changes that challenge an addictive person's self control and interfere with their ability to resist intense urges to take these drugs. The brain changes can be persistent, which is why drug addiction is considered a relapsing disease. People in recovery from drug use disorders are at increased risk for returning to drug use even after years of not taking the drug. As a person continues to use drugs, the brain adapts to reducing the ability of cells in the reward circuit to respond to it. This reduces the high that the person feels compared to the high they felt when they first took the drug, an effect which is known as tolerance. They might take more of the drug to try and achieve the same high. So the brain adapts often lead to the person becoming less and less able to derive pleasure from other things they once enjoyed, like food or social activities. Long-term use can also cause changes in other brain chemical systems and circuits as well. So this can include learning, judgment, decision-making, stress, memory, behavior. Despite being aware of these harmful outcomes, many people who use drugs continue to take them, which is the nature of addiction. Listed here are some potential signs of prescription drug abuse. Now, every individual is different, so some may have a few of these, may have several. It depends on each person. So these are potential signs. There's bloodshot eyes, clumsiness or an impaired coordination, constricted or dilated pupils, decreased rate of breathing, drowsiness, flushed skin, forgetfulness, inability to concentrate, nausea, vomiting, personality or attitude changes, slurred speech, or sudden weight loss or weight gain. Teens and adults abuse prescription drugs for many reasons. This can be to feel good or get high, to relax or relieve tension, to reduce appetite or increase alertness, to experiment with the mental effects of the substance, to maintain an addiction and prevent withdrawal, to be accepted by peers or to be social, or to try to improve concentration and academic or work performance. Listed here are some of the behavioral problems associated with prescription drug abuse. So this can include forging prescriptions, stealing from friends and family, robbing pharmacies, not fulfilling familial and other responsibilities, decreased performance at job or school, preoccupation with obtaining, using, and recovering from usage of opioids, lying to others to cover the amounts of drugs taken, withdrawing from one's pleasurable activities, social isolation, restlessness, or lethargy. Now remember, a person who is addicted to prescription drug abuse will do anything to obtain that high or to obtain the substances and continue their addiction. They do not think about the harmful consequences because they don't have the capability to do so since the drug has taken over their brain. So, why do people abuse drugs? There are several reasons people abuse drugs. Usually, there are underlying issues such as trauma, abuse, depression, anxiety, isolation, social family problems, or other mental health problems. They can use drugs as an unhealthy coping mechanism. They form a habit. It can be genetic predisposition, which means they have a family history of substance abuse. There can be peer pressure. People who take drugs is because they want to change something in their lives and thinks drugs are a solution. Some reasons some youth give for taking drugs is because they want to fit in, they want to escape or relax, they want to relieve some boredom, they want to seem grow up, they want to rebel, or they want to experiment. So it is difficult to face one's problems, but the consequences of drug use are always worse than the problem, the one they are trying to solve. Someone who is receiving treatment for prescription drug abuse will usually go through two main categories of treatment, which is behavioral treatments and medications. Behavioral treatments help individuals stop drug use by changing unhealthy patterns of thinking and behavior, teaching strategies to manage cravings and avoid cues and situations that could lead to relapse, and providing incentives for abstinence. Behavioral treatments may take form of individual, family, or group counseling. When it comes to medications, it can help relieve withdrawal symptoms and cravings. Listed on the slide are three of the most common medications used to treat prescription drug abuse. Some of the core messages I would like for you to take away regarding prescription drugs is it is never okay to share your prescription with others or take another person's prescription. It is never okay to take your own prescription to get high or for any purpose other than what they were intended for. It is never okay to change the amount of a prescription that you are taking because you think that you need to take more or less to feel better. It is very important to stay in contact with your primary care doctor regarding your prescription drugs. So, these are some of the commonly asked questions about prescription drugs. The first one is, what exactly is a prescription? So, a prescription is a doctor's written order that authorizes a pharmacist to supply a specific medication for a patient with instructions on its use. It says who can take the medication, in what amount, and for what length of time. It is used exactly according to a doctor's instructions. Now, the second common question asked is, how does a doctor determine the prescription a person needs? So, a doctor writes a prescription based on a patient's medical history, symptoms, and other factors. So, the doctor will usually ask questions such as, are you allergic to any medications? Are you currently taking other medications? These questions help the doctor decide which medications to prescribe and which ones not to. The next question is, are prescription drugs safer than illegal drugs such as cocaine? Abusers of prescription medications may mistakenly believe that because the drugs come from a pharmacy and not from a drug dealer, they are safer to take, even at high doses or without a prescription. The fact is that if someone takes prescription medications in a manner that is not as a doctor intended, he or she could face serious health risks, and for certain medications, those risks could be addiction and death. Also, abusing prescription drugs, including sharing prescriptions with friends, is illegal. Another question asked is, how can prescription drugs cause death? So, opioids such as Vicodin or Oxycontin can depress respiration, which means slowing down a person's breathing, or stop it altogether. They can shut down the part of your brain that tells you to breathe. That's how people die from an overdose. Mixing certain prescription drugs with alcohol is especially dangerous. If both substances depress respiration, they may amplify each other's effects when taken together, meaning the risk of serious harm or death becomes much greater than when either one is taken alone. Now, the last question is, when is someone abusing prescription drugs? So, prescription drug abuse is when someone takes a medication that was prescribed for someone else or purposely takes his or her own medication in a manner or dosage other than what was prescribed. Abuse can include taking a friend's or a relative's prescription to get high, to help you study, to lose weight, to build up muscle, or to treat pain. Even over-the-counter medications can be abused when not taken as directed. Now, these are all the sources I took my information from. Feel free to visit these sources. There is a lot of information regarding different kinds of drugs and substance abuse. Thank you for viewing Scans Futuros Brillantes presentation on prescription drugs. If you have any questions or would like to request more information, you can reach us at 956-724-3177 or visit our website at scan-inc.org. There are other resources you can visit as well, such as samhsa.gov or cdc.gov. Again, thank you for watching.